Hey, Matthew Holtz, want to hear something funny?
Okay.
All right, so my calendar popped up a notification that I should start planning for JP Morgan Healthcare in January.
Is that so you can get your liver in training? So
I get my liver in training and order my stack of business cards. I'm just gonna go stand outside the Westin St. Francis and like beg people to like talk to me.
Yeah, it may be a little quieter than you would hope this next time. Yeah.
I don't know. We ponder the mysteries of 2021's funding landscape on the December 16th episode of Health in 2.0. JP Morgan, that's one of my favorite conferences of the year. How will we ever know how frothy the health tech market is without a series of investors to tell us so at a rolling agenda of cocktail hours?
I'm looking forward to the 5th year in a row for Elation to say that prices are way too expensive. She does have a point, because somebody came and found out that the current IPOs are now trading on average at 24 times revenues, which is the same they were trading at in 1999. Do you remember what happened in 2000, 2001? Jess?
Yeah, I remember, because I went into college and then graduated from college shortly thereafter with like no job, no money, no signing bonus. It was like the world I went into college starting out with was completely upended.
That may be happening now, but I think we've got some stuff to keep us going just in the last
just dying embers. 100 million plus rounds to talk about in the meantime. What do you mean valuations out of control? All right, timer ready. Hit start, my friend. All right, we're kicking off with, what do you think about Cityblock? We've heard from everybody but you. $160 million. Their total is 300 million. General Catalyst is in there with some others. What do you think?
Look, great idea, great companies, got a decent number of people, 70,000 people according to Kevin O'Leary under management, which is a decent chunk similar to Oak Street. On the other hand, how much money is there in mining the very poor? Look, it's a great company. As I always say, wonderful service. I'm not sure I'm moving to New York City and becoming very poor just to become a customer.
All right, what about Elation? They get 40 million. This is actually Cityblock's EMR, along with Crossover Health, a bunch of these independent primary care clinics. What do you think of this one?
Yeah, new EMR, well, not that new. Kina Fong's been around running this company with her brother for like 6 or 7 years now. I interviewed her a few years back. It's cool, it looks better. It's a very tough market to get into, especially as so many EMRs are consolidating, hospital providers that are consolidating under, under the banner of people who use Epic and Cerner. But, good luck to them. It's amazing there is such a thing as a new EMR market.
All right, Modern Health gets 51 million in a C round for the 4th pillar of care. I don't know what the first 3 are or how many pillars there are. Matthew, help.
It's like Action Jack Barker's conjoined triangles of success on Silicon Valley. Who the hell knows what it actually is? It's another mental health entry in that market. There are just so many of these companies now well funded. Incredible, but.
All right, we'll see. What about LeanTaaS? Another big raise, 130 million for them. What do they do?
Yeah, they're kind of like the front operations part of hospitals, like for operating rooms and using AI to make stuff smooth out and work better. A bit like LeanTaaS, a bit like
it is LeanTaaS we're talking about.
It's like a bit like Qventus, unlike Olive, which is like the back office, but we all care about that stuff.
All right, what about Well? Well gets 40 million in a
Oh, the timer rooster is here. I can't turn him off, which is kind of appropriate because,
well,
let me tell you. I mean, so, not to be confused
Hold on. Well, 40 million in a Series A. Matthew Holt, tell us about Well.
By the way, 40 million in Series A to be added to the 25 million they had in a seed round, a 25 million seed round last year.
That's a pretty big seed.
Not to be confused with, this is well.co, not to be confused with well.com, which is the original whole earth electronic link, first internet site ever, which you'll find out.
Not Well Health. This is not Well
Not to be confused with Well Health, which is a messaging system that's now working with Cerner, talking to consumers. Not to be confused with Well wealthy with a Y.
Even though they do behavioral economics, like wealthy.
With the coaching system, not to be confused with Wealthy Therapeutics, one of those companies from India who were like a therapeutics company. Not to be confused with Wealth, which is the one which it also uses behavioral economics, gives you money in your account. If you don't take the pills you should take, takes the money out. So I'm not entirely sure what Well is going to do. They have 65 million. Gary Loveman is the guy who's running it. Was at Harris for many years, where he figured out how to make a lot of money out of sort of seniors who go and play the slot machines, and maybe they're the same kind of people he wants to motivate in his new gig. He spent some time at Aetna. I'm not quite sure what big impact he had at Aetna. He was kind of there at the later end of the Mark Bertolini era, doing stuff before the CVS merger. And I had a look at the website. It looks like a bunch of health information, some coaching and stuff, and it's going to be different from everybody else. And how? Well, I don't know.
Well, maybe having a very differentiated name will help them.
I think they should take some of the 65 million and spend it on a branding firm to come up with something different. That's my free advice.
Well, I mean, it did take us a minute, to figure out exactly which one we were talking about. This is like when we have doctor or anything, we get confused there too. Also, Cloud is another one.
Perhaps they should call it Dr. Well.
Dr. Well Cloud.
Ooh,
Dr. Well Cloud. Nice.
Who knows? I suspect under the hood they must be working. I mean, it's not announced. They must be working with some health plans, and I suspect.
Well, they're well funded.
Or somebody's in there, but and you look, if it's navigation and improvement of care and all that stuff, it's all good stuff. We need it, and we know it's a big problem. But you've got Accolade out there, you've got Grand Rounds, you've got a bunch of people, doing other types of navigation. Not to mention all those companies like K Health and Babylon and the people doing the front door stuff that, with the chatbots. So this space is incredibly crowded, but it is the General Catalyst folks. They have their more Livongo winning Sapali in there, and they probably have some idea what's going on.
They have closed a bunch of deals over the last 2 weeks.
Oh my word. Well, I think if they don't sit on that money, they have to give it back, right?
Oh, is that how that works? It must be nice to have so much money to spend. Well, hey, what does your shirt say? Real quick.
Thank you to my children for buying this for me.
People who tolerate me on a daily basis, they're the real heroes. Oh, amen to that, my friend.
Yes, apparently my children.
Okay, all right, let's get out of this. For those heroes who tolerate him on Twitter every day, you know who you are. And if you're not one of them, go follow the big guy. He is that Bolty boy over there on Twitter. And you know what I would love to have sent over to me? Find me at Jess Tomasa and come up with your very own health tech startup name. What combination of Dr. Cloud and Well can you do? I'm sure there's a couple others too, but I love that stuff. And we all just, pick that stuff apart. And of course, to never miss an episode of Health in 2.0, be sure to go to thehealthcareblog.com and subscribe to our email newsletter. We curate the best content of the week from the blog, slap these Health in 2.0s in there, and call it a correspondence. Mr. Holt, have a great week. There's got to be another big deal coming our way next week. I can feel it. One more before the year ends.
One more, 100 million, 200 million, 300 million, merger,
acquisition, somebody do something. Yes. We got it here next week. We'll talk to you guys soon. Thanks so much for watching.